Hello and welcome to African American Health Matters.
This is Ed and Pat Sanders with health tips and information because your health does matter. The information in this broadcast is not intended to substitute for personal medical advice. Now, before making any decision about your health, please consult a physician or a qualified healthcare professional. Our organization has over 103 partners across the country who are dedicated to patient education, advocacy, and finding ways to better access health and disease resources for African Americans. This broadcast of African American Health Matters is one of the health outreach tools used to reach millions. Thanks to Cyberstation USA, and thanks to you for tuning in.
African American Health Matters is a new mobile health text message and multimedia outreach that provides health tips and reminders to subscribers right over their cell phones. Our website, www.africanamericanhealthmatters.com, has updates and information about diseases, tips, audio messages, and later this year, video slices of doctors talking about critical diseases that affect African Americans.
African American Health Matters partners with events and conducts focus groups and surveys to find out just how African Americans are accessing their health information. There are critical numbers of African Americans dying from prostate, breast, lung, and colon cancer, but a lot of times it's treated too late. Now, even more African Americans are affected by diabetes, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we're still needing continuing education and more information about HIV and AIDS. Our surveys show that we need more ways to access resources available in our community.
Yes, and Papa, do you know what? There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. What we need to do is educate more people about the importance of clinical trials.
I agree completely. For our audience, we're talking to Dr. Norman H. Edelman. He is the American Lung Association's leading medical authority, having served as the association's chief medical officer for 25 years. He's a highly sought-after expert on all matters pertaining to lung health, and he is a seasoned media veteran, and that's exactly what we're looking for. So welcome to African American Health Matters, Dr. Edelman.
I'm happy to be here.
So radon and secondhand smoke. Now, back to radon very briefly. Are there any geographical areas like parts of the country that have basements? Because there's some parts of the country, like some places in California, that they don't have basement because of the faults and things like that. But are there any parts of the country that tend to have more radon emissions than others?
There are, and I can't give you a list of all of them. Northeast Pennsylvania is one of them.
Oh, okay.
They sit on a big chunk of rock that tends to generate a little more radon than other places.
Mm-hmm. So that's some northern area. Before we get to our last question, when we started, you mentioned the study, which I'm so sorry we didn't get a chance. Can you highlight just a few points of the study that the American Lung Association?
The American Lung Association published on April 12, 2010, that's almost a year ago, a report which was called Too Many Cases, Too Many Deaths, Lung Cancer in African Americans.
Okay.
And it can be found on the website of the American Lung Association.
Okay.
That's lungusa.org.
Okay.
And here are some of the findings. Here are some of the highlighted findings. Despite lower smoking rates, African Americans are more likely to develop and die from lung cancer than whites. Mm-hmm. African American men are 37% more likely to develop lung cancer than white men. Mm-hmm. Even though their overall exposure to cigarette smoke is lower. African Americans are more likely to be diagnosed later when lung cancer is more advanced.
Right.
African Americans are more likely to wait longer after diagnosis to receive treatment, to refuse treatment, and to die in the hospital after to surgery.
Yeah, some of those you mentioned earlier in the program. So, yes.
So those are highlights, and I can go through some of the numbers if you'd like.
Sure, go ahead.
So let's talk now about 5-year survival rates of all lung cancers.
Okay.
African Americans overall, it's 12.4%. Whites, it's 15.9%. In men, it's less in both, and in women, it's more in both. Women seem to do a little better, even though they smoke about the same. Let's see. Here's another statistics that I mentioned. In terms of surgery, whites with lung cancer, 61% are likely to have surgery. African Americans, 34%.
Wow.
Chemotherapy, whites, 46% are likely to get chemotherapy. African Americans, 28%.
Whoa.
So,
that's scary. Now, doctor, I have a question about these huge gaps in these numbers. Is this due to the ignorance or the lack of education, or does it have to do with racial disparities in healthcare and the medical institutions? What accounts for this huge gap of surgery and
it's a really great question, and the experts don't rule out anything that they suspect there are a lot of different things involved.
Yeah.
There's no question that African Americans have a harder time getting first-rate health care than whites. And it's not always a matter of insurance. People have to understand that.
No, it isn't.
African Americans with the same insurance as whites may still have a harder time getting treatment. But there are other things as well. I mean, some experts have said there are cultural issues.
Yeah.
African Americans don't trust the medical establishment as much.
That's true.
Because after all, most of the medical establishment is white.
That's right.
So we don't think there's any single issue. We think it's a complex set of interacting issues, but it's important.
It is important.
Because lung cancer is the leading cause of death from cancer. It exceeds everything else, including breast cancer in women. So it's a big deal, and it's a big problem. It's a big health problem in the African American community. And that's why the American Lung Association a year ago decided to do a special study and make a special report on the issue.
Well, we definitely want our audience to go and take a look. We're going to take a look at that report, and we may be doing some facts and figures on that later in the year. But that is lungusa.org. That's the American Lung Association.
Right, and if you have trouble getting through the website, just call the person you called at the Lung Association to set up this conference.
Okay.
And what is the American Lung Association doing to help reduce lung cancer?
Well, we have a multi-pronged approach. As you can see from the very poor success rates of treatment, the real key is prevention.
Yes, it is.
And the American Lung Association is front and center on that. We have been in the anti-smoking business for years and years and years. We started there.
Even before it was popular.
And there's been a recent report in the Journal of American Lung Association a few weeks ago showing the dramatic reduction in smoking. And not only in heavy smoking, but in the uptake among kids. And of course, the American Lung Association was ahead of everybody else, for example, in California, advocating for a large increase in the cigarette tax. Cigarette tax is the best way to keep kids from smoking.
That's true.
So we, of course, campaign vigorously for clean air. Next week, the American Lung Association is going to release its State of the Air report, which will tell communities how they're doing in controlling air pollution, whether they're better or worse than other communities, whether they've gotten better or worse over the years. And as I pointed out, air pollution contributes to lung cancer. So we're very deep into the prevention side, which, as you know, is always the best way to handle the disease.
That's right.
We also have an innovative new research program. We are funding scientists who are willing to take a chance and explore new ways, new approaches, untested ways to treat lung cancer. See, one of the problems we have with lung cancer is that for many, many years it got less attention in terms of research support from the federal government and from the Cancer Society. And we think that's because many people say, oh, well, that's a self-inflicted disease.
Okay.
You know, if they hadn't smoked, they wouldn't have gotten it.
Right, yeah.
We don't believe that.
That's true.
We believe that smokers who get lung disease and lung cancer are victims, because almost all of them have started when they were youngsters, kids, teenagers. So they've been addicted by a voracious tobacco industry.
Yeah.
And in every sense of the word, they're victims. And we believe that we ought to make efforts to treat them, to find better treatments, in addition to finding better ways to prevent smoking and to get people to quit smoking.
Okay. Well, you know, this has been a wonderful, wonderful opportunity for us to share with you and for you to share with us, Dr. Edelman. We are so honored and pleased to have you with us, and thank you so very much for participating and delivering some very vital and important information about lung cancer and lung disease. Thank you very much.
It's my great pleasure.
Thank you.
We're moving into news for this week. And here's some news.
A study shows that calorie intake rises when fast food restaurants are nearby. Blacks in the Southeast consume more if they live within 5 miles of a fast food restaurant. Increased access to fast food restaurants is associated with higher calorie intake among Black Americans in the southeastern United States. A new study found that. Also, researchers analyzed data from 4,740 participants in the African American Jackson Heart Study. Now, researchers didn't find any consistent associations between the availability of fast food restaurants and body mass index BMI or waist circumference.
A new study shows that gene variant is linked to sudden cardiac death risk in blacks. Roughly 13% of people of African descent may be at risk of potential fatal heart arrhythmias, the study shows. A common gene variant among black people may be linked to the development of life-threatening heart arrhythmias, and this is when the heart beats too fast, too slow, or irregularly, according to a new study. In pinpointing this gene, Duke University Medical Center researchers hope to one day help doctors determine which patients may likely to benefit most from the implantable cardiodefibrillator. This is an ICD, and it is a device that automatically detects and corrects potentially deadly heart rhythms by delivering a jolt of electricity.
When you have advanced prostate cancer, you're fighting for your life. But do you wonder if radiation therapy is enough to win the battle? Researchers are exploring an investigational agent intended to turn on your immune system, which may allow it to attack and kill cancer cells. If you have advanced prostate cancer and would like to be part of a research study investigating this treatment, call 877-547-8839 or visit www.clinicaltrialspotlight.com.
My name is Tiffany Powell. I'm a physician at UT Southwestern. I'm finishing up my cardiology training. Today I want to talk about, I'm mainly focusing on obesity as a risk factor for cardiovascular disease. And this could be a talk that could take an hour, but I want to focus on two things: nutrition and exercise, as really being the foundation for how you maintain your cardiovascular health. And if you remember anything I say tonight, the main thing I want you to remember is that you really need to know your numbers. And the numbers that I'm talking about, I'll give you. So why do nutrition and exercise matter? Really, they're the basis for your health. And healthy eating and exercise, regular exercise, really improve your energy, make sure that you have the energy to do types of things that you want to do. But they also work at controlling your blood pressure, your blood sugar, your cholesterol, so for diabetes, for hypertension, for high cholesterol, what you really need besides your medications are exercise and healthy eating. They also decrease your risk of heart attacks or strokes. So if you want to prevent the heart attack that your family member may have died from, or the stroke that a family member may have had, you want to make sure that you eat well and exercise. And with that, you will increase the time you live and really have a long and healthy life. And so with that, why should we care if we're overweight or obese? Why does that matter? I mean, a lot of us may say, well, I feel good. I'm doing what I want to do. I may have an extra couple pounds that I, need to get rid of, but why do I really need to worry about that and work on that? And it's not just a cosmetic thing. It's really something you should care about, because if you want to connect the good eating and the healthy eating and exercise to the benefits from it, you really want to work with weight control. And that's not to say that everybody wants to be a stick figure and be, completely at their healthy weight, but you want to be working towards a weight, or you want to include nutrition and exercise as a part of your lifestyle, so that you're working towards the healthy weight for you, for your body size. And so when we talk about knowing your numbers, these are the two of the main numbers that you really want to know: your body mass index and your waist circumference. Your body mass index is what we as doctors use to help us figure out whether somebody's overweight or obese. And it's basically a measure of your weight in relation to your height. And so if someone tells you that your body mass index is above 25, if it's between 25 and 30, that means you're overweight. If it's 30 and above, that means you're obese. Now, a lot of us say, okay, that may not apply to me. I'm very athletic, or have a lot of muscle mass, so I don't listen or necessarily pay attention to my body mass index. Another important number besides the body mass index is your waist circumference, because that really tells you where your weight is. If your waist circumference is above what it should be, it's telling you that your weight is really distributed at your belly, and that's not where you want it to be. And so measuring your waist circumference is measuring the distance around your waist just above your navel. And for men, it should be less than 40 inches. And for women, it should be less than 35. So yeah, it's a big issue. But those are two of the main numbers that you really need to know. As far as how you measure your body mass index, there are plenty of calculators out there. You can use tools online on the web. If you have an iPhone or a smartphone, you can get calculators that you can download onto your phones. But this is just a quick way of just one of the calculators that's available online, where you put in your height and weight, and it spits out what your body mass index is. And so, how can you use that to really figure out where you need to be? And this is another way of looking at your body mass index, and I know it's hard to see, but basically this is another tool you can find online, and it basically is a chart of body mass index showing you, based on your weight and your height, where your body mass index is, and then you can use this to figure out where you want to be.
Each week, we have tips from our mobile text message, and here's some for today.
Cholesterol. Green tea as a healthier alternative to sodas and sugary beverages can help lower your LDL cholesterol. This comes from www.webmd.com.
Remembering to take your medications? Write a list with medications, time, date, and tape the list to the mirror in your bathroom. This comes from www.wikihow.com.
Asthma. Certain health conditions can make asthma more difficult to manage, like sinus infections, reflux disease, stress, and sleep apnea.
African American males die more frequently from sudden cardiac arrest due to hypertrophic cardiomyopathy, or HCM, than any other demographic. There are warning signs, and there are steps that you can take to protect these young lives. Learn more about hypertrophic cardiomyopathy and sudden death in the young at 4hcm.org, which is the number 4hcm.org. Take care of those young lives. They've got promising futures ahead.
Hi, I'm Jason Snelling of the Atlanta Falcons. On the football field, I face challenges head-on. I do the same when it comes to tackling life with epilepsy. I was diagnosed with this condition while in high school, and nobody was talking about it then. In fact, many people still don't talk about epilepsy because they worry about how they'll be treated when others find out. As a spokesperson for the Epilepsy Foundation's African American Outreach Program, I share my story to end the fear and mystery about epilepsy.
A public service from the Epilepsy Foundation.
Get the facts.
Visit www.epilepsyfoundation.org or call 1-800-332-1000.
The Patient Advocate Foundation CEO and President, Nancy Davenport Ennis, personally became involved in legislative reform when a close friend, Cheryl, was not only battling cancer, but also her insurance company, which refused to cover her clinical trial treatments. While her friend Cheryl bravely fought for her life, Nancy, with help from the Virginia Task Force for Insurance Reform, worked on reforming coverage for cancer patients. In 1994, the task force was victorious with the passage of Virginia House Bill 240. But Nancy didn't stop there. She founded the Patient Advocate Foundation. All of these cases involve patients with chronic, life-threatening, or debilitating conditions. Some need help taking on their insurance company. Others have no insurance, while others have coverage but need financial assistance to buy medicine. None of these clients will ever have to pay for the help they receive from the Patient Advocate Foundation. And the foundation is able to successfully resolve more than 98% of the cases it takes on.
Well, when patients call PAF, oftentimes they have a myriad of issues that they're faced with. What they can expect from us is comprehensive, individualized services designed to help with their immediate need and also identify future needs that they may have as they move through illness back into good health. Our case managers are highly trained, they have diverse backgrounds, and when a patient calls our 1-800 number, they're immediately connected to a live case manager. The case manager does an initial assessment of their needs. We fill in an intake form where we capture all data necessary to work their case, and then that case is assigned out to a case manager based on area of specialty that will work with that patient from initial intake through full resolution.
When people call us, they're desperate. Every avenue available to them to solve the problem has not worked, and it's their life that they're fighting for. And at the end of the day, you're going to battle to save your life medically, but we don't want you to have to battle to save your life financially and to feel that you're losing all of your integrity and your hope because you can't get the financial issues solved or an insurance issue solved. We can do that for you.
It's very important that the people in this country realize this organization exists and that they know how to get to them, how to contact them, and get the help they need.
For more information, please visit us at www.patientadvocate.org or call us at 1-800-532-5274.
Don't look at me with a frown face. You know you need to get it right. turn it around, jump up and down, move to the left, and move to the right, turn it around, jump up and down, get low, get low, get low, get low, get low, get low, bring it up, bring it up, now bring it up, bring it up, now bring it up, bring it up, now bring it up, bring it up. Okay, ladies, here we go again. Tell me be your doctor, not your friend. Put cigarettes down, I recommend. If you die too soon, it will be a sin. Now wait, freeze, don't eat that. Fatty foods cause heart attack. Arteries hard like dental plaque. And when you die, you can't come back. Go red, rise, take control. Save your mind, body, and soul. It's never too late and you're never too old. Cross that finish line, take and go. Time for you to exercise. Work your booty, hips, and thighs. We hope that you recognize we're red. That's right, we're saving lives. Yeah. Let's go. I don't wanna keep it in. I just gotta let you know. Cause I wanna see you live. I don't wanna see you down. All my ladies, when we red, let's get your hands right. Let's go. And move to the left, move to the right, turn it around, jump up and down. Move to the left, and move to the right, turn it around, jump up and down. Get low, get low, get low, get low, get low, get low, bring it up, now bring it up, bring it up, now bring it up, bring it up, now bring it up, bring it up.
That was Dr. Ronnie Whitfield's rap on raising awareness about heart disease. You can see the video by going to www.cyberstationusa.com/AAHM and click Let's Go.
Be sure to tune in on Fridays from noon to 1 to African American Health Matters on Cyberstation USA.